अस्सलामुअलैकुम औज़ुबिल्लाहि मिनश्शैतानिर्रजीम बिस्मिल्लाहिर्रहमानिर्रहीम। तो आज हम बात करने जा रहे हैं स्मॉल वेसल वस्कुलाइटिस के बारे में। So what is small vessel vasculitis? It is the inflammation of the small vessels like capillaries, venules, arterioles, etc. And this is divided mainly into two groups: the anca-associated small blood vessel vasculitis and the non-anca-associated. We have already discussed the classification in the other lecture. So the anca-associated small blood vessel vasculitis includes the microscopic polyangitis, Wegener granulomatosis, or the granulomatosis with polyangitis, or the Churg-Strauss syndrome. And the non-anca-associated vasculitis include all of the following like SLE vasculitis, inoxian lone purpura, cryoglobuline vasculitis, or Woodfast-Chur disease, etc. So we will discuss in this lecture. We will only discuss about the anca-associated small blood vessels vasculitis. So before starting the anca-associated vasculitis, we must know what is anca. कि anca क्या होता है? So anca stands for the anti-neutrophil cytoplasmic antibody. Anti-neutrophil cytoplasmic antibody. It consists of four words. Anti mean against, neutrophil means neutrophils, and the cytoplasmic antibodies means that these are the antibodies which are formed against the antigen released from the cytoplasm. Against the antigen released from the cytoplasm. So mainly they are autoantibodies. So the definition is it is a heterogeneous group of autoantibodies, and these are mainly directed against the neutrophil granules, against the monocyte lysosomes, or against endothelial cells. So it is the definition, it is a heterogeneous group of and autoantibodies directed against the neutrophil granules, monocyte lysosomes, or endothelial cells. In a simple way, it is a antibodies which are formed against the antigen released from the cytoplasm. तो ये आंका की definition है. अब आते हैं टाइप्स की तरफ के आंका के कितने टाइप्स हैं. So there are two types, C anca and the P anca. C stands for cytoplasmic and the P stands for the peripheral. Peripheral anca. These were the previous name given to these types of anca. Now they are called the anti-proteinase 3 or the PR3 anca. What is anti-proteinase 3? What is proteinase 3? So proteinase 3, it is usually a constituent of the neutrophil granules. They are released, for example, this is a neutrophil. It consists of small granules, and this granule consists of proteinase which is called proteinase 3. So these are the anca which are formed against this proteinase 3. So they are called anti-proteinase 3 or the PR3 or proteinase 3 anca. And the other type is the P anca, which is also called anti-myeloperoxidase or MPO anca. So what is myeloperoxidase? So it is the constituent of lysosomal granules. For example, this is a lysosome and it consists of many granules. So one of the granules is the myeloperoxidase. So if they are released into the blood or the circulation, the antibody which are formed against this myeloperoxidase, they are called the P anca or the anti-myeloperoxidase or the MPO anca. Now coming towards its important point, that the C anca is mainly associated with the vasculitis like the Wegener granulomatosis. So its concentration जो है वो Wegener granulomatosis में इंक्रीज होती है, और जो P anca है और anti-myeloperoxidase और MPO anca है, इसकी जो कंसंट्रेशन है वो मेनली किस चीज़ में इंक्रीज होती है? वो मेनली इंक्रीज होती है डिजीज लाइक माइक्रोस्कोपिक पोलियंजाइटिस और चर्ग-स्ट्रॉस सिंड्रोम में. सर्कास सिंड्रोम में। तो पी अंका इन दोनों के साथ एसोसिएटेड है, इनकी कंसंट्रेशन ब्लड में इंक्रीज होती है, और जो सी अंक की कंसंट्रेशन है वो वेगनर ग्रानुलोमाटोसिस में इंक्रीज होती है। अब आते हैं इसकी पैथोजेनेसिस की तरफ के अंका किस तरह वास्कुलाइटिस काज करता है। तो क्या होता है कि दो anca producing agent like the drugs or microbial antigens or different types of infection when occur, तो ये क्या करते हैं इन्फेक्शंस, तो ये इंड्यूस आंका फॉर्मेशन, ये आंका को फॉर्मेशन को इंड्यूस कर देते हैं। इन्फेक्शन में क्या होता है कि न्यूट्रोफिल्स जो है एक्टिवेट हो जाते हैं, तो न्यूट्रोफिल्स और दूसरे टाइप्स जो सेल्स हो उसमें क्या मैक्रोफेज वगैरह में लाइसोसोम्स होते हैं। अब लाइसोसोम्स क्या करते हैं कि जब ये एक्टिवेट हो जाते हैं तो लाइसोसोम्स से जो है वो ग्रेन्यूल्स रिलीज़ करते हैं। ग्रेन्यूल्स में जो कंस्टिट्यूएंट होते हैं, फॉर एग्जांपल द प्रोटीनेज और माइलोपेरोक्सीडेज, वो सर्कुलेशन में क्या हो जाते हैं, वो रिलीज़ हो जाते हैं, सर्कुलेशन में रिलीज़ हो जाते हैं। अब ये जो है वो इन्फ्लेमेशन काज करते हैं। जब इन्फ्लेमेशन काज करते हैं तो इन्फ्लेमेशन में जो है बहुत इंपॉर्टेंट स्टेप्स होते हैं कि इसमें सबसे पहले जो है वो न्यूट्रोफिल्स की रिक्रूटमेंट होती है, तो न्यूट्रोफिल्स जो है वहाँ पर आ जाते हैं। अब ये क्या करता है, अब ये क्या होता है कि यही आंका जो इनकी वजह से, इन तमाम फैक्टर्स की वजह से इंड्यूस हुए हैं, ये इन न्यूट्रोफिल्स को एक्टिवेट कर देते हैं। इट विल बाइंड एंड एक्टिवेट these neutrophils and it will be activated. These neutrophils will further activated, which will further release the granule contents and the reactive oxygen species, which will cause the endothelial damage and thus it will cause vasculitis. In short, factors like drug, microbial agent and the infection will cause the activation of neutrophils through the formation of anca, and this anca will activate these cells releasing granules and its contents like reactive oxygen species, which will damage the endothelial cells and will cause injury. तो इसकी शॉर्ट सी पैथोजेनेसिस हो गई। अब आते हैं जो 3 डिजीजेस थे हमने आंका एसोसिएटेड वास्कुलाइटिस के साथ पढ़े थे, उसकी तरफ आते हैं। तो इसमें जो सबसे पहले जो वास्कुलाइटिस था वो क्या है, वो वेगनर ग्रेनुलोमाटोसिस था, और इसको ग्रेनुलोमाटोसिस विद पोलियंजाइटिस भी कहते हैं। पहले जो थे प्रीवियसली इसको वेगनर ग्रेनुलोमाटोसिस कहते थे, अब इसको ग्रेनुलोमाटोसिस विद पोलियंजाइटिस कहते हैं। इसकी डेफिनेशन के तो इट इज़ ए नेक्रोटाइजिंग, फर्स्ट इंपॉर्टेंट पॉइंट ग्रेनुलोमाटोसिस, सेकंड इंपॉर्टेंट पॉइंट इट इज़ ए नेक्रोटाइजिंग granulomatosis vasculitis of organs like nasopharynx, lungs and kidneys. They are mostly involved. Nasopharynx, lungs and kidney. It is a necrotizing, it means that there will be necrosis agar granulomatosis, and there will be a chronic inflammation, vasculitis of organs like nasopharynx, lungs and kidney. And these are more characterized by the clinical triad, which includes the necrotizing granuloma of the upper respiratory tract and the lower respiratory tract with the fibrinide necrosis, as we already discussed. Necrotizing granuloma upper respiratory tract and lower respiratory tract with fibrinide necrosis and causing the symptoms like sinusitis, nasopharyngeal ulceration, etc. इसमें क्या होता है, नेक्रोसिस होगी और ग्रेनुलोमा की फॉर्मेशन होगी। कहाँ पर, अपर रेस्पिरेटरी ट्रैक्ट और लोअर रेस्पिरेटरी ट्रैक्ट, ये जो है और पहला ट्रायड का पहला पॉइंट है। दूसरा जो है देयर विल बी नेक्रोटाइजिंग और ग्रेनुलोमाटोसिस वास्कुलाइटिस ऑफ द लंग्स। इस तरह हमने कहा कि इसमें क्या होता है, नेसोफेरिंक्स इन्वॉल्व होता है, तो नेसोफेरिंक्स इज द पार्ट्स ऑफ अपर रेस्पिरेटरी ट्रैक्ट। दूसरा जो है लंग्स इन्वॉल्व होते हैं, तो लंग्स में क्या होता है, ये नेक्रोटाइजिंग और ग्रेनुलोमाटोसिस, ग्रेनुलोमा या बनेगा या नेक्रोसिस होगी, वास्कुलाइटिस ऑफ द लंग्स वेसल्स, एंड इट विल कॉज सिम्टम्स लाइक वेसल्स लाइक हेमोप्टिस विद बायलेटरल न्यूट्रल लंग इन्फिल्ट्रेट्स। थर्ड जो पॉइंट है जो ऑर्गन इफेक्ट करता है मोस्टली, वो है किडनी। फोकल और सेगमेंटल टू क्रिसेंटिक रैपिडली प्रोग्रेसिव necrotizing glomerular nephropathies cause symptoms like hematuria etc. तो ये clinical triad है, consists of 3 necrotizing granuloma of the upper respiratory tract or lower respiratory tract necrotizing granulomatosis vasculitis of the lungs, and the focal or segmental to crescenting rapidly progressive necrotizing glomerulopathies. So you can see in these pictures that there are small vessels which are surrounded by the granulomatosis inflammation, and this granulomatosis inflammation is characterized by the giant cells. These are the giant cells. We can also see the fibrinide necrosis. Now coming towards the people at risk. So the people at risk are mostly the elderly people, and it is, as we already discussed, it is associated with the increased C anca level in the serum. C anca level. So how to diagnose this disease? So we can diagnose this disease by doing the biopsy of the vessels, and in biopsy we can see the necrotizing granuloma. We can also treat this. We can treat this patient with the drugs like cyclophosphamide or the steroids. Coming towards the second disease, which is the microscopic polyingitis. It is also called the hypersensitivity vasculitis or the leukocytoclastic vasculitis. Hypersensitivity vasculitis or the leukocytoclastic vasculitis. Coming towards its definition, तो इसकी definition ये है कि it is a necrotizing vasculitis. In the granulomatosis with polyangitis हमने कहा था necrotizing granulomatosis, लेकिन ये granulomatosis नहीं है, सिर्फ necrotizing है, सिर्फ necrosis होगी. Vasculitis of the capillaries, venules and arterioles of the multiple organs like the skin and mucous membranes, characterized by the symptoms like palpable cutaneous purpura. Brain, characterized by symptoms like seizure, etc., GIT, which will cause the abdominal pain, and the heart, which can result in many types of cardiomyopathy or other ischemic heart disease. Skin, brain, GIT, and heart, but mostly they involve the organs like lungs and kidney, and in the lung they cause the pulmonary capillaritis, inflammation of the capillaries of the lungs, and which can be characterized by the symptom like hemoptysis, and the kidney, where it causes the necrotizing glomerular nephropathies, which is characterized by the proteinuria and hematuria. The important point is that there is no granuloma and ulceration associated with this microscopic polyangitis. There is no granuloma and ulceration, in contrast to the Wegener granulomatosis, which consists of granuloma and ulceration both. Coming towards its causes, so it is mainly due to the antibody which forms against the antigen like drugs or microorganism, etc. And this antigen antibody complex can lead to the immune complex depletion, or these antibodies can also so coming towards its causes, so it is mainly due to the antibody forms against the antigen like drugs, microorganism, and this antigen antibody when combined can lead to the immune complex depletion, different types of vessels which can cause vasculitis, or either these antigen can cause the anca formation, and this anca is mainly the P anca, and this is the anca which is related to this kind of disease which is called the microscopic polyangitis. Now towards the morphology, so it is characterized by the fibrinide necrosis of the media. As you can see, this is the fibrinide necrosis, the lumen of the vessels. And this is the fibrinide necrosis, or the fragmented as well as viable neutrophils. You can see the neutrophils. Some are fragmented. For example, this one is the viable neutrophils, and this one is the fragmented neutrophils. These ones are the fragmented neutrophils. And the important point which will distinguish it from the granulomatosis with polyangitis is that there is no granulomatosis inflammation. The treatment is same, that we can treat it by giving the cyclophosphamide or the steroids. other slide which you can see. This is the slide. You can see the vessels which consist of the thrombus and the associated peptide necrosis. You can also see different types of neutrophils. Some are pigmented and some are viable neutrophils. And this is the picture of the lungs, which you can see the nodular cavities. These are the nodular cavities which are associated with the microscopic polyangitis. The third important disease is called the Churg syndrome. It is also called the allergic granulomatosis or the angiitis. It is a necrotizing granulomatosis inflammation involving multiple organs like lungs and etc. It is mostly associated with the symptoms like asthma, allergic rhinitis, lung infiltrates, and the peripheral eosinophilia. These are very important. So if a disease involves the organs like lungs and heart and associated with these kind of symptoms, so it is the Churg syndrome. Again, this is a necrotizing and granulomatosis inflammation in contrast to the microscopic polyangitis, which is only a necrotizing vasculitis. It is characterized by symptoms like cutaneous palpable purpura, GI bleeding, renal disease, which is due to the glomerular nephropathies, and the cardiomyopathy, which is the major cause of death. Cardiomyopathy, and the cause is mainly the hypersensitivity reaction to normal allergic stimulus, and it is associated with the much more increase in the serum P. anca. So these were some of the anca-associated vasculitis, and in the other lecture we will also discuss the non-anca-associated vasculitis.